everyone. In New York and New Jersey, new cases continue to diminish every day. Since the peak of around 30,000 cases per day on March 29th, we have seen a steady decline, which is very reassuring. We're in the phase 1 reopening, and there's some good news. We're starting to get closer to phase 2. Governor Murphy in New Jersey has released restrictions regarding high school graduations and college graduations. And we're hoping that we'll see some outdoor ceremonies with socially distant measures and care to avoid new infections. Sports may return to New Jersey as professional teams change their policies based on each league's independent protocol. We may soon see youth sports return. The specific guidance regarding youth sports has not been provided yet, but soon enough, we'll be able to see small groups convening and practicing. In the meantime, masks are still essential for public use. The idea of using a mask has some myths and truths. There's a lot of talk about the virus being airborne, and in being airborne, the potential to infect one person to another at a distance. In certain specific scenarios, such as a respiratory therapist performing a procedure where droplets are being expelled, in the public, that's a much lower concern for contamination. The most likely route of contamination is droplet. And so a facial barrier that protects nose and mouth from projecting those droplets, landing on surfaces, landing on people, preventing people from touching their faces, these are the ways that we're going to decrease the spread of infection. So while the mask itself can't filter out viral particles, the droplets that the virus lives in cannot be projected from nose or mouth. When we speak, when we breathe, we're slowly exhaling and projecting tiny droplets which contain virus. With a mask on, that's not possible. So whereas you might have heard of airborne contamination being a possibility in this virus, what we've learned, similar to what we've learned about fomites, surfaces that can contain the virus, is that the risk is lower than we had originally anticipated. So the mask does prevent the spread of the virus. Another concern we've heard is that the mask is going to cause hypercapnia. Some people may feel a little anxious with a mask on, and yes, you will have a little tiny increase in the amount of carbon dioxide that you inhale. But there are studies that show that wearing a mask, even for a prolonged period of time, such as in a healthcare worker over the course of about 12 hours, can increase the carbon dioxide level in that person's blood by a very small amount, but not in a physiological or pathophysiological way, meaning that the impact of wearing a mask, even for 12 hours, like an N95 respirator, doesn't actually cause any harm. So that's a myth. Washing your hands is probably the most important way to prevent the spread of this virus. We know that the common cold is often spread from hand to face. So just the simple act of not touching your face. And if the mask is doing one thing, certainly it's preventing you from touching your face. So don't touch the inside of your mask if you're adjusting it. Make sure your hands are clean when you're taking your mask on or off. Keep some hand sanitizer in your car so that you don't have to drive with your mask on. I've seen people driving alone with masks on. I only have to assume that's because they're apprehensive to take the mask on and off. So keep some hand sanitizer with you that you can use after going into or out of a store. Another myth about wearing a mask is that you don't need to cover your nose. Wearing a mask under your nose doesn't actually prevent the spread of virus. If you're using a cloth mask, you can wash this in your washing machine. I wouldn't suggest doing the same for surgical masks. These can break down in that type of an environment. But the cloth mask can certainly be washed and dried per routines with your usual laundry. If a mask is damaged or has holes in it, you shouldn't reuse that. What about an N95 mask with a valve on it? You see these for industrial work. These masks should not be used for prevention of spreading the virus. The way that mask works is it protects the user from inhaling dust or other small particles, but the valve on the mask allows droplets to be expelled. So that type of mask really doesn't help to protect others from droplets that you can expel. While wearing a mask is not a guarantee that you won't get infected, if two people are wearing a surgical mask, the risk of transmitting that virus decreases by about 90%. When one person is wearing a mask, it's about 60%. The idea is that we want to have people in the routine of using masks because the more of us who subscribe to this public health measure, the more likely we are to slow down the spread of this virus and see ourselves entering the next phase of reopening. Small groups and gatherings outdoors are not a terrible idea. As long as we can socially distance, wear a mask, it's relatively safe at this time to get together with friends and family in very small groups. I wouldn't recommend groups of 10 or larger convening, especially without masks or without the appropriate guidelines for social distance. I'm becoming increasingly optimistic that we're starting to see the end of this huge peak that we saw in March in New York City. And I'm hopeful that other cities will follow strategies that will allow the prevention of this virus from finding a new way to its second peak. While we're anticipating there may be a second peak in the fall, right now we're seeing a nice steady decline. So I hope we can all remain vigilant, and I look forward to seeing you all again soon. Be well, be safe.